Hey, this is Jessica DeMassa with WTF Health. What's the future of health? I'm talking to the who's who of health tech and healthcare innovation. And today we are jumping into the hot space of menopause care, and not hot just because of the hot flashes, but because there just seems to be a lot of interest in providing niche care to women who are 40 plus. And so here to tell us all about this market and one of its hottest startups is the CEO of Midi Health, Joanna Strober. Joanna, it's great to have you here.
I'm excited to be here. Thank you.
Oh, I'm excited to dig into this. So you have built a virtual care clinic for women 40 plus dealing with perimenopause, menopause, and more. And like I said, I think this is one of the really hot emerging areas within women's health that is getting a lot of attention lately. So why don't you start us off though by describing what you guys do at Midi Health and what you've built there? Because I think a lot of people right off the bat when they hear menopause care immediately associate that with hormone replacement therapy, which is has some back and forth to it. But you guys have actually built more of an integrated care model that includes some of that, some non prescription types of approaches, botanical supplements, like even just good old fashioned like getting some exercise. So I'm really curious to hear, about your model and what you guys are doing to help women through perimenopause and menopause.
Great. So we started MIDI about 2 years ago to essentially provide expert care to women when they were no longer being taken care of by a gynecologist. And the reality is that most gynecologists spend their time and training on delivering babies, but they're the only ones who have expertise on women's health in the later years, because most doctors are not trained in that. So what we realized is there was this opportunity to go to the experts in women's health, and women's health holistically is a big offering, right? So what does that mean? It means bone health. It means brain health. It means hot flashes. It means things like anxiety, depression, definitely painful periods and painful sex. There's a lot that goes into women's health and the different things that are happening to our bodies when we are in our 40s and 50s. And none of that requires in-person care. So what we realized is that we could go to the experts, and we spent a year building out these care protocols for all these different types of care and really understanding for every one of these issues, was there a hormone solution? Was there a non-hormone solution? Was there a supplement solution? Was there a lifestyle solution? Putting all of that in one protocol and then getting insurance contracts so we would be able to offer really high-end insurance covered care and expertise to women for all the different things that they're experiencing. And so that's essentially what the MIDI platform is. We offer care, importantly covered by insurance, by experts for all the different health issues that you go through during this age category that don't require in-person treatments.
I love that. And I want to hear a little bit about the experts, because this is one of those things that when I'm reading on your website, I'm like, oh my God, how does one become like an expert in like, menopause, perimenopause care? Because I mean, my understanding is that like if you're an OBGYN, it's covered in your training, but not a lot. Like, what I read was like, it's just a couple hours. So tell us a little bit about the experts that you have and how they've become experts.
So most of the experts are researchers, right? So there are people who research brain health in women over 40, or there's people who research sleep. There's really expert researchers around the country. They're very siloed in what they research. So we had to go to all of them and basically say, you're an expert in the brains, and you're an expert in hormones, and you're an expert in bones, and we want to take all of your information on the best care protocols and integrate them. So we have a care protocols that look like this. I mean, it's pretty in depth. But then what we do is we train nurse practitioners to deliver those care protocols. So the experts are pretty diffuse, but then we also enable the nurses our providers to ask the experts questions on Slack when hard questions come up. So all day long, we have a complex care channel, and they see women who have a really large variety of complicated health issues, and they're able to talk to an OBGYN or to an internal medicine specialist or a PON expert and get expert information that then they can give to the patients. So that's how we're really scaling super high quality experience and expertise.
I love that. And I want to come back to some of this information that you're collecting in a little bit. But before we do that, I want to hear about how this integrates in. And so, I mean, you mentioned you're covered by insurance, you've got your own care providers. So like what happens with the information that you guys and the care plan that you've got the woman on, through MIDI? How does that integrate with like everything else that, so like the primary care, the regular old primary care, or any of the other care that a woman might be receiving? Like, tell us a little bit about the integration there.
So first of all, 40% of women who are coming to us, 40% have not gone to a doctor in 4 to 10 years.
Ooh.
So they are not all getting care, and we become more of their primary care provider. So that is part of our population, and it's a pretty big part of the population. The women are probably taking care of their parents, or they're taking care of their kids, but they're not taking care of themselves. So we are then talking to those women and making sure they're getting their mammogram, making sure they're getting their colonoscopies, making sure they're getting pap smears. We can basically function as some of their primary care as well as take care of their symptoms. For the other 60% that already have a provider, we integrate. So we use Athena and we integrate into their medical system. One thing that we heard loudly from the women that we are working with is they don't want to leave their system. They want to get care within the system. And so we partner with healthcare systems and we integrate our data. So if you go to UCSF and you're a patient there, when we see you, we see all the tests you had there and any of the blood tests and everything else. And then we share data back with them. So it's a really key part of our value proposition that we are integrated in the overall medical system.
Okay, that's great. That's definitely one of the best ways I think that you can approach that. Talk to me about your business model then a little bit too, because we're talking about the insurance coverage piece of this. I understand you guys also, I mean, you go direct, which I think is really cool for anybody who doesn't have, a nice PPO plan that will cover this. And you're also selling to employers. So, who seems to be the most interested in providing Midi or using Midi as a service right now? I mean, where are you guys gaining the most traction in the market?
So we are fee for service, but we are covered by insurance companies, right? So in California, we have about 80% of the PPOs. We don't go into a market until we have 40% of the PPOs. So we are insurance covered care. And so women are looking for us and they're going on websites and Googling how to find a menopause provider or a hot flash provider or a sleep medicine provider, and they come to us for care. Our best marketing is our webinars and the expertise that we offer. So we go to employers and we say, we will give a webinar to your employees about menopause symptoms. Sometimes we have 2,000 people come to those webinars. And then we get hundreds of questions and we tell them how they can take care of themselves and we let them know about Midi. Midi is already paid for by their employer because their employer is paying for their insurance and we're insurance covered care. So that's how we coordinate with employers. We give basically webinars to their populations. And we found that an incredibly powerful, it's marketing for us, right? So we're not asking employers to pay for us. We're in network with their insurance companies. So, but we market because employers know that this is a significant part of their population and they want to provide services for them. So that's a very effective marketing channel for us. We also do the same thing with health systems. So when we work with a health system, we will do joint education events to educate their population on, is it thyroid or is it menopause, or weight loss for women in midlife. There are a lot of different things that we can offer them, and it's very much about education. And once people realize that we are the experts, which is really what we are, then that's how we get patients. And we are very busy with patients. So we're growing incredibly fast with patients who are seeking us out for care.
Okay, so that's really interesting. So you guys, because your insurance covered, it's almost like you're like a specialist, like within
Right.
the same way you would look at like going to the eye doctor. And that's really interesting. Okay. I wasn't sure if you guys were selling direct to employers, which is the way that, we see a lot of health tech startups
Right.
start out. But no, that's really fascinating that you're going in that direction. And that makes a lot of sense. I mean, and with the employers too, I mean, I feel like this is, especially lately, like there's just been a lot of news about menopause out there. I mean, the New York Times just, published another article. I guess Mayo has completed a study talking about just how much money a year is lost to women because of menopause. It's something in the tune of like $1.8 billion a year. So, I mean, talk to me a little bit about this, Joanna, because I'm curious about like the macro environment around menopause right now, because it seems to be having a moment. And I think it goes beyond like Gwyneth Paltrow and Goop here. I mean, like, it's just, that's part of it. But I think that, even within, traditional healthcare, the focus on women's health, 40 plus seems to be gaining, a lot more traction. What are you seeing out there? I mean, is menopause still like a taboo subject among like investors? I mean, or is it among employers, like among health plans? I mean, what do you, give us a state of play on the taboo around menopause for patients, employers and plans, and investors.
My sense is that women are demanding better care. Finally, we're demanding better care. And we are realizing that we do not need to suffer through all the things that are happening to us during this age category. And so we are asking and demanding for better care. And that's where this is all coming from. We finally have a population that is very sophisticated and is doing the research and is finding out that actually I do not have to have anxiety. I can sleep through the night. Sex does not need to be painful. There are things that I can do to fix that. And so I believe a lot of this is starting from this very educated consumer base that's saying and really demanding that they're treated better. I've interviewed so many women who have thought about leaving their jobs because of debilitating menopause issues. And when you use the word menopause, you think, oh, well, that's nothing. But you know what? It's anxiety, it's sleep, it's vertigo. It's a lot of things that happen to women in their bodies, and they deserve better. They just deserve better care during this category of their life. And so they're finding places they can go, and they're kind of demanding it, which is exciting to me. Now, I will say, recently at the Forbes conference, they had 2 days of lectures of the top brains in medicine, right? And they have doctors on every panel, and they had researchers on every panel, except the menopause panel. And the menopause panel was 2 actresses talking about supplements called Unworry and Unanger.
Oh, no.
And so to me, that is actually counter to what I'm seeing in the world. I am not seeing that at this point, women are looking for tinctures called Unworry and Unanger. What I'm seeing is that they want real care. And I think women are asking and demanding finally that they get real medicine. Some of those might be supplements. There are good supplements when appropriate that you should take, but they should be real supplements, and they should know what you're taking, and they should be high quality. And I think, finally what we're seeing women say is, look, I deserve and I demand to get expert care. So we don't sell products. Like, our job is not to sell products. Our job is to have expert practitioners who talk to you, who understand your medical condition within the scope of all of your health, not just let's talk about your hot flashes. So let's talk about your brain health. Let's talk about your cardiovascular health. Let's understand what's going on in your body, and then give you the correct prescriptions and recommendations for you. If that's a supplement, that's great. If it's a hormone, that's great. But let's make sure that you get the care that you deserve so you can feel better.
One of the things I love about your website is that your entire leadership team, I'm going through prepping for this, and like all of you have like the regimen that you're on, like within your bio, which I think is really interesting because you can see like kind of the mix of things, and it's not the same like woman to woman to woman. Like, it's really actually interesting. I was like, once I realized it at the bottom of yours, I clicked through everybody. So I was like, oh my God, they all have this and they're all on something different. But it's like, that's one of those things that I think is, kind of overlooked. So, I mean, talk to me too. I don't want to leave behind, the business side of that and some of the taboo around it. Do you feel like that's starting to change? I mean, you spoke, I mean, so passionately. I mean, you got me all fired up about, hearing about, women as patients, as consumers demanding something different. But, when it comes down to, push comes to shove in healthcare, a lot of the decisions are made by men, whether it's an investor or, somebody who's choosing to integrate something in and deploy. And how are you feeling about how your message and how talking specifically about this kind of care is falling on those ears? Like, I mean, I want to believe that they're open, but tell it to me from your perspective. I mean, do you still think there's some taboo around talking about menopause? When it comes to decision makers who are of the opposite born gender?
When it comes to talking about investors, I'm just talking to them about numbers. So I'm not talking about menopause. I'm just talking about numbers. We have a lot of women coming. We are growing incredibly fast. And that is what is powerful. And it's a profitable business model. And there's lots of women coming to get care from us. And so we really focus on the model. And what we can show is there's a lot of tailwinds because women are looking for this type of care and there's not a lot of places for them to go to get it. So we are the beneficiary, I would say, of a lot of things that are happening in the zeitgeist of women's health. So it's mostly exciting to me, actually, that there is interest, but the interest is not, I want to invest in a menopause company. The interest is, I want to invest in a fast growing, profitable company.
I like that. I'll take that. I'll take that every day, actually.
Yeah.
I would rather be that than be the box that has to be checked because we had to make a women's health investment, right? Speaking of those headwinds, that you mentioned, I was reading New York Times is like real hot on menopause lately, like within like the last 9 months, like passion project over there. I love it. But one of the things one of the articles I read was, talking about menopause being like, the menopause gold rush. Talk to me about that. Like, do you think that what we're going to see moving forward is this category start to kind of explode? I mean, and if so, what do you think is behind that? Not only the consumer demand, but is there something generationally about like this generation of women that's starting to turn 40? Like, what are you seeing there? I'm just curious, as somebody who's obviously got their finger on the pulse in this market, what are some of the things that you think are help kind of making this into a category that's really getting a lot of interest right now?
Look, this is half the population that has a lot of money to spend and wants to feel better. I think that is the reality. In that New York Times article, they talked a lot about celebrity brands and what celebrities are selling. And that's great if women want to go buy their products, but that was really more focused on women getting marketed to as beauty issues, beauty products. And I think that's great. You shouldn't just market beauty products to women in their 20s because honestly, women in their 40s have much more capital to spend. So targeting them makes a lot of sense as a business. But I think overall, this is not a niche market, right? We are talking half the population. All of those women are going to go through some menopause symptom or another, all of them. So this is just a really big market of underserved people who deserve better care. And however they get that, whether it's products that are appropriate and effective, or whether it's people like us who are providing the care, I think there is opportunities to make sure that women are getting higher quality options for them.
Let's talk a little bit about those protocols that you mentioned earlier, because I want to dig into this because I feel like in my mind, I'm like, ooh, this is the way that we can improve the entire course of women's healthcare moving forward for all mankind, or all womankind, as it were. So tell me a little bit about that. I mean, and maybe some of the tech that's behind the scenes. Like, are you guys, what are you doing to kind of maybe help collect information from women about symptoms or what works and what doesn't, and who and how and there, and all of that stuff to kind of come together to maybe help impact the way that menopause or perimenopause care is delivered in the future? Let me hear a little bit about that.
So before you come to us, we have you fill out a pretty long assessment. It's quite complex. It has a lot of questions in it, but it is designed to enable us to track outcomes. And so we ask about all the different symptoms you're experiencing. We really try to get to know you from that. Two things happen. First of all, that is shown to the practitioner before your visit, so they can be prepared for your visit. And if you have any complicated health issues, they can have screened it with an expert before your visit. That enables us to scale really high access, high quality care. But it also means that then every time you come back, we're able to ask those same questions and see what is feeling better and what's not. So it is part of our strategy to enable. It's basically part of our strategy to track your symptoms and make sure that the medications we're giving you are helping. This takes titrating. This is not a one size fits all. It really isn't. Even if you want hormones, and honestly, probably 80 to 90% of the people do want hormones or do end up with hormones. But even if you're thinking about hormones, there's a patch and a pill and a cream and a gel and a vaginal cream. Which one is right for you? Let's try one of them. Let's see if you feel better. Then let's go on to the next one. Let's see if that works. Did we give you a high enough dosage? Are you now sleeping through the night? It takes time and it takes titrating. It's just not a one size fits all. And I think that's really important. So for every one of our protocols, we have a hormone path. So if you want to try the hormones, we can figure out which one is appropriate. We have a non-hormone medication path. So medications you can take that are not hormones. And then we have supplement recommendations if that's the type of medicine you want. That often it can be effective, but takes more time and more iterating in order to make work. So women can choose. We are not trying to get you to do any of them. We just want to help you feel better. So if you want to try a non-hormonal solution first, try that for 2 months and then come back and tell us if you're working. And then we're tracking that to see whether it worked for you. And over time, we should have a lot of data that shows what's working and what's not, and help how to, use that data in order to give more appropriate treatments to people.
That sounds awesome. I mean, I'm hoping that comes around sooner than later, because it is kind of like a black hole out there on the internet.
Yeah, right.
I mean, it's true. I mean, there's just not a lot of high quality, medically valid information out there. So I think that's really commendable. All right, so what's next for you, Joanna, for Midi Health, as a company? I mean, you guys have raised $14 million in a seed round, so there's lots of opportunities that you're growing really fast. Last I saw, 12 states you guys are rolled out in right now.
Yeah.
So, I mean, tell me what's ahead, what's on the roadmap, near term, and then kind of moving forward.
So the goal, we are listening to our women. So we have two things. First of all, by the end of the year, we should have 30 states. Ooh. And that's what we're aiming for. Hopefully those insurance contracts will come through. And then we are figuring out what types of things women are looking for most. So we've thought about a brain health offering. Is it Alzheimer's or is it menopause? And making sure that we're thinking about those type of things. We are talking about bone health. And there's a lot of concern with women. How do I keep my bones stronger as I'm aging? So we're looking at building out a bone health clinic. We're looking at building out a thyroid clinic. I mean, but what we're seeing is we're talking to the women who are coming to us. We're looking at the list of symptoms, and then we're creating protocols for them based on what we're seeing in the marketplace. I mean, what they're asking for and what issues they have and what they're not getting taken care of elsewhere. So, for example, one of the things that we're most proud of is that we are one of the only places to go for women who either had cancer or have a hysterectomy. We have expertise in all of that, and who can take hormones and who can't, and what are the appropriate treatments. So that's one of our core competencies. So we're expanding that, and we're expanding that through partnerships with hospital systems who are sending their patients to us to get that kind of care. Then we're also looking at that same thing for bone health. So for example, if you're a woman and you have a fracture, is it osteopenia or osteoporosis? Have you gotten tested for that? So we can then send you to get a DEXA scan, and we can then help you to figure out what you need to do in order to keep your bones strong and healthy. So we can eventually take care of the very full spectrum of care. And we're really driven by what women are asking for us for, and what needs are in the marketplace. Where are the big care gaps? Our job is to solve the big care gaps for women in this age category.
All right, Joanna. Well, this is so exciting. I mean, the best of luck to you. Not like you need it. You're a serial entrepreneur. I mean, that should go without saying too. I should mention that we had actually met with your previous startup, Curbo, when you guys sold it to Weight Watchers. So it's not like you don't have a successful track record here. But I love this offering. I love the intention that's going into designing your services and deploying them. Love that it's covered by insurance. That's a business model that I think is incredible to have, accompanying you in your virtual care clinic. Awesome. Great job. So Joanna, you'll have to come back and give us an update on how things are going, especially if this year we add a little bit to that seed funded, coffer that you have going on there. But until then, thank you so much for joining me. It's been a pleasure to talk to you.
Thank you.
All right. Well, we will check in with Joanna again. And until then, if you want to find more conversations with the who's who of health tech, as they are changing the way that we do healthcare, you can head on over to my YouTube channel. It's youtube.com/WTF Health. Joanna, thank you again. We'll talk to you real soon. Take care.
Great. Thank you. It was really fun.
Thanks.